Hello, everybody. Welcome back to Local Beauty. I'm your host, Jackie Rodman, and owner of Local Aesthetics. I'm joined today with Lakeesha Murphy. She owns Woman's Body Alchemy, and she's actually a registered nurse. She is the first nurse we're bringing on the podcast. Unfortunately, we weren't delighted to get a nurse on Beauty Bound, but there's just been a lot of, I guess, a lot of hate and then a lot of just backlash on, I think, providers in Texas who were providing a lot of medical procedures without being a nurse. So we're going to kind of dive into that topic today, and then we're going to dive into what Lakeesha does and then how she came about and started in this industry. So, how did you get started? Like, what made you want to be a nurse? Like, let's go there first.
Honestly, I wanted to be a nurse in high school. I'm not quite sure. I don't remember the aha moment, but at first I wanted to be a pediatric nurse practitioner. And then I dealt with kids and I was like, yeah, not my thing, not my jam. So I ended up getting pregnant pretty young. And I had my son, and then I saw midwives and I was like, oh my God, that's what I'm going to do. So I went to nursing school to become a midwife. Actually, like, there was no other goal. There was always just like, I have to get to midwifery. So I got my ADN in 2011. I got my bachelor's in 2016, and then I got my master's in 2021. That came with my midwifery degree. And then recently, about a year and a half, maybe 2 years ago now, the state of North Carolina passed legislation stating that midwives over a certain amount of practice, so 4,000 hours, are independent autonomous practitioners. So in the state of North Carolina, I am my own medical director. I don't need an MD behind me. I can do pretty much anything within my scope without any kind of backing or anybody behind me having to oversee me. So that gave me the idea of being able to actually offer a place where women could get, it started off as a hormonal health thing. So treating like PCOS, perimenopause, just hormonal imbalances, because I would hear it so often in my day job, how women were struggling with these issues, but their labs were normal. And so I started turning more to a functional medicine route, and I don't offer insurance for that reason. I know that's kind of controversial, but usually insurance has become this thing where it dictates medicine. So me and my patient may have a plan, and maybe everybody's on board. We think it's a great plan, and then insurance says no. And so now they're bummed out because they know there's a plan, they know there's an option, but it's not being offered to them because some random person in Indiana says no. So that's how this was actually born. I ended up adding the aesthetics on because I started taking courses for like injectables, and just over the time shadowed people. I have a mentor in Greensboro. He owns a med spa, and so I go up there and like learn a lot from him, the business side and the actual like clinical hands-on side. So it's just a learning experience. I'm growing. I want to be able to help and empower women in from the inside out, and I feel like when you look good, you feel good. So that's part of the empowerment and the healing for me.
Wow. So you've been in this industry a very long time.
Oh wow.
And you've had so many different experiences, I bet. I guess, let's start with like nursing, I guess, and backtrack. How has it changed since getting first, licensed?
So getting your license, yeah. So it was a lot. There were certain rules you would hear. So they say, coming out of nursing school, don't specialize, go to med surg, learn everything, and then you can specialize later. I did not. I never followed that. I went straight to NICU and then to labor and delivery. So I've done maternal child my entire career, outside of maybe 2 years where I did case management. But I specialized just because I knew what I wanted to do. So that's one thing. Now they don't tell you that as much anymore. They'll just say, like, go ahead and go do, what you want to do, get as much experience there. Also, it used to be, I feel like, a more respected field back when I started. Everybody's like, oh, that's the money maker. And now it's like, no, you can definitely make the same amount of money as nurses are making without any kind of degree, without any kind of licensing. So it's not that. So it's changed to where a lot of people are looking kind of like, what's the benefit of nursing anymore? There's staff shortages, there's pay shortages, excuse me. And then after COVID, the respect level for healthcare has drastically decreased. So you see a mass exodus of healthcare workers wanting to get out of healthcare and trying to find something else to do. I did not necessarily want to leave healthcare, but I needed to get away from, like I said, insurance oversight and the things that were just, taking a toll on our bodies, our mental health in the hospital setting. So I think that's a big change. I hear that just across the board with a lot of nursing staff is that it's changed so much that it's all just patient satisfaction centered versus actually medicine. So I think there's a major shift coming in healthcare, and I don't necessarily think it's for the better, but hopefully at the end of this, I think that if people start to buy into concierge medicine and buying into the fact that they don't need always insurance plans, and that they can go to like an integrative, a holistic practitioner that will address everything, and they're pretty much paying that, monthly fee or whatever, which would be less than their insurance, but they're getting more personalized care. So I think that is what the shift is going to be more in the future. It's coming now. We're just kind of at the crumbling point. I think we're imploding a little bit in healthcare.
Wow. So you said you have like this master's from the midwife background. So how is that different, I guess, than a like nurse practitioner?
So what we get categorized as advanced practice registered nurse. So in that group would be the midwives, would be the nurse practitioners, and that's all the nurse practitioners, geriatric, through family nurse practitioner, through pediatric, any nurse practitioner, they're an APRN. And then you have the CRNAs, which is the Certified Registered Nurse Anesthetists. And that's kind of your big three groups. They are governed by the Board of Nursing, but we are a little bit different as far as we have DEA licenses. We have all the prescriptive authorities that MDs would have. The NPs do need oversight still, so they still usually need a physician on their license to say, hey, if I mess up or I have a question, I have to go to this provider, this collaborative doctor. The midwives, like I said, now half of us have now transitioned onto where we don't need that provider on our license. We're just on our own. The newer baby midwives still need that, productive, collaborative doctor, hopefully an OB, to go to say like, hey, I have questions. Hey, can you look this over? And that's usually their kind of point of contact. I think that does keep people safe, but I do understand that there's a big push from a lot of the nurse practitioners and CRNAs. They also want that autonomy because, as a nurse, if I've been doing this for 20 years and then you have a doctor who's been doing this for 2 or 3 years, we've been in the same environment for, a while, and you can see that a lot of these, advanced practice providers are really good at their job and they know what they're doing. They just came about it in a different route. Now, should we manage scopes as to what you've learned and, have to gain additional education? Yes, definitely. Everybody needs to be safe, prudent providers. However, I think with healthcare going the way it's going, you're going to see a lot more autonomy from what they call mid-levels. I hate that term. Just a provider, I don't want to be a mid-level. So I think you're going to see a push because we're cheaper. People look at us as a cheaper option. We didn't go through the $400,000 schooling, so they can afford to pay us less. So I think that we're going to see a lot more of us in the coming future. There's definitely a pushback from the MDs, the DOs, the
they're always
the doctors. Yeah, there's pushback from them, and they they have their reasons that they feel like they're more qualified in certain things, and they do. They have training in certain things that we don't, but on the day to day, some of those things aren't needed for what we're doing. Just like an urgent care NP is not going to be doing major surgery that maybe a critical care MD would be doing, but you're going to be seeing all the urgent, semi-urgent things that are not quite an emergency that the bulk of people are. So getting people through the healthcare system by delegating an appropriate level of care for as their provider. As a midwife, I'm not going to see this super complex, high risk, twins mom that has diabetes and all that. I might check in with her and provide congruent care, but she's going to be seeing a doctor. She's going to be seeing a surgeon because that's an appropriate level of care. Now you have a young, 21-year-old mom, doesn't drink, doesn't smoke, is super healthy, first baby, no issues. That's a very appropriate level of care for a midwife to take care of. So I feel like just delegating the patients appropriately would be helpful, and everybody can still see patients, and patients I think will have better outcomes because we're not, the MDs like they see a lot of high risk things, so they catastrophize things, and then people who are like me who see a lot of low risk things might see something that's high risk and kind of be like, well, I really don't know what to do with this. So I think the appropriate level of care is the important thing when it comes to that.
That's awesome because I had never like even met a midwife. I don't think like I had a
There's
doula.
not very many of us.
Yeah, like I had a.
I think I'm number 236 in a state to be independent.
Oh my gosh, because like San Antonio, there were a lot of like birthing centers, and I knew a lot
Yes.
that did go.
I see
See a
them on
midwife.
Instagram too. Yeah.
Yeah, and I didn't even look into it. I got a doula and I went to the hospital and stuff, and she was great. But like, I didn't know like, okay, you can have a doula, you can have a midwife, you can have a doctor too.
So Texas is big, I think, on the CPMs, the certified practical midwives. Don't kill me if that's wrong. So they don't go through the nursing route. They'll usually have a bachelor's in another
Oh, interesting.
respect,
Oh,
and then they'll do a almost like an apprenticeship. And that is kind of controversial, I guess, in the birth world. There's people on both sides. Some are for, some are against. So I'm not even sure if in North Carolina they are allowed to birth. I think a lot of them do work in birthing centers and support women. I don't think they by themselves are allowed to be a birthing attendant. So yeah, there's different levels definitely to the midwives, and I think a lot of people think of like lay midwives who are like out in the forest. But yeah, no, I worked in hospitals my entire like 15-year career, high risk. I worked at 3,000 baby a year birth facilities. So like
Wow. Okay. So are you like what facility are you like doing your midwifery or
my midwifery? Yeah, my midwifery.
Okay. I was like,
no, midwifery. People say that a lot. Yes. Or like this one guy he said that means he thought that meant I was the second wife, and I was like, why would that be? Why would I use that as my job title? I am the second wife. But I'm over here down in a rural health hospital in Sanford. So yeah, and I do public health, not the health department some days. So we do some community outreach as well.
That's great. That's great, really. So how did Woman's Body Alchemy come out of this? Like when were you like, I'm gonna take my own reins and open my business and have my practice? Was this brewing for a while, or did you were you just like
not at all? Actually, it was when one day I saw a friend of mine get certified in Botox and fillers. I just kind of shot her a message and said, how did you do that? What company did you go through? And she was like, this is a medical education training course through this company. So I signed up and I ended up doing my training and was shadowing and following people. And I just thought this could be a nice little side gig.
Yeah.
And so that's how I got a lot of my practice. Actually, I was doing Botox for very cheap, pretty much like at cost of supplies. And I was like, I don't have a lot of experience, but if you're willing to offer your face up, why not?
Yeah.
So, I practiced with another midwife actually who had got certified years earlier as well. So she kind of gave me some pointers and keep me safe until I felt good enough to go out on my own. Initially, I had started this business with an old partner of mine. He was he had a major in like kinesiology or body mechanics or something like that. Exercise science, that's what it was. And then he also had a massage therapy license and all that. So he was very into like body work, and we had initially thought, hey, we're gonna do this, holistic. You do the body work portion, I do the hormones, and he also used to be a personal trainer, so he would do like diets and workout. Like so, basically the whole holistic integrative health type thing. That did not work out business wise. So I just thought, hey, why? Just because that portion's gone doesn't mean I can't push and keep on going with my own portion. So I just kept going, and then slowly over the course of about a year and a half, started doing the background stuff, getting my papers in order, getting legal, making sure I have all the right permits, blah blah blah. And then in August of this year, I did my official grand opening, and yeah,
that's amazing. No, it's always good to shadow someone too and see what they're doing. So I feel like there's always like new techniques too coming out, and all these terms.
Self-learning is so great. I signed up for like all the free webinars from like all the nurse injectors. Like if they ever offer free webinars, I'm on it. Like Yeah.
Does the company you get your products from to like do their own training, or do they just?
They do. So some companies are better than others. So usually if you order products and then tell the rep like, hey, we have a new injector on board, they'll come down, they'll do some training with you. The products themselves, I'm having an issue with the vendors because they have not recognized the independence of the midwives in North Carolina yet. So I'm ordering with a physician right now. So we have our own little contract. We work that out. So that's been helpful. Unfortunately, I still have to do that. Hopefully, in the next coming years, they'll change their policies to match with the laws.
You said the law just changed, right?
Yeah, like a year and a half ago.
A year and a half ago. Okay, so there's a lot of doctors that are and physicians that are catching up.
Mm-hmm.
And so, besides you being able to own your own business, like what like level do you have to be your own like provider?
So at least a master's or above, and the only ones in North Carolina right now would be the midwives. Other than that, you would have to have your doctorates. But I went through a healthcare lawyer for that reason to make sure I was in compliance. And so she was like, talking to the board. I called up to the board, made sure everything was good there. She went through her medical board, as she said at my, LLC and all that, to say, basically a medical director does not have to be a doctor if they are an autonomous provider. So really, it would just be the autonomous midwives and the DOs, the MDs, the doctorate prepared providers at this point in North Carolina. Now, different states are different. Some states have nurse practitioners that are able to be autonomous and all that. So I think it's kind of state specific, and that's why it's so good to get your healthcare lawyer by your side.
That's amazing. Yeah, I've never even considered that. Like, there's a lot of, I guess,
because you hear it on the news all the time, like, RN busted for practicing medicine. Because, it's like, yeah, you're practicing medicine. You don't have a director to evaluate and do a good faith exam. So yes, you may know what you're doing. You may have been injecting for 20 years. The state's going to look at you and say, where's your oversight?
Right, because, yeah, in certain states, like, they will allow an NP to be a medical director. And then in certain states, it's only MD. That's it.
Yes, in a lot of states, they're very, very strict on that. I was actually surprised when I went through my lawyer because I thought she was going to tell me, medical director with her in the board. We're like, no. And I was like, her in the board. Yeah, because the board I called first, and then they were confused because they were also like, no, if you're an RN, you need an MD. And I'm like, yes, but I'm autonomous. And they're like, I said, can you transfer me to the advanced practice registered nurse section, please? Thank you. And then
oh my
gosh. She's like, yeah.
That's incredible.
It all kind of aligned for me. Yeah, so I feel like body alchemy was very appropriate because it just all kind of manifested and alchemized its way for me.
So what are your thoughts about, I guess, in other states? Like, I'm coming from Texas. There's other states too, Texas, Arizona, Florida, that allow just anyone to have a medical director. They can just be, any profession and just do like Botox injectables on the side. Like, where does it go? Kind of like, I guess, I'm trying to figure out the right words. Like, gray to where it's like there should be some medical knowledge here for certain things.
Well, I feel like that's gray because there's a lot of aspects to that. So, one, as the patient, who is held liable when there is a severe or bad outcome. If they're not licensed, what is there to take? There's nothing to take from them. There's nothing to say like, hey, you're practicing negligently. So that's one thing. What, they might get jail time or criminal, thing, but there's what is there to verify that you have knowledge on this. If an MD trusts in a person and they've been technically trained so well on this thing and they're willing to put their license on the line for that, then that's that individual medical director's prerogative if that's what the money is worth to them. My hesitation on that would be is Botox is not like I see a lot of the people ordering like black market Botox and like injecting themselves at home.
Oh,
and yeah, it wouldn't stumble across it in the algorithm. It just does not go away for a while. So I see these people, they're doing it, and their technique is horrible because they don't know the anatomy of the muscles of the face, and that's just one of the things where healthcare background is going to help you. You know, if I'm saying like, hey, we want to inject more lateral on the orbiculus ori, and I'm like, and I'm like, okay, what muscle is that? What does it move? What is it going to do if you inject one side and not the other? So yeah, I can easily draw dots around the wrinkle and say, hey, this is what I'm going to do, or copy other providers. But when I'm examining a face and doing my good faith exam, I'm looking at how are their muscles individually responding, what are their nuances on their face. If I do this, what's going to happen to this muscle? So it's that anatomy component that I think is lacking in non-medical providers. That would be the hard stop for me as a patient, that I would be like, yeah, no, thank you.
Right. And we do see a lot of patients still like choose like estheticians, for example, in Texas, or
they're trusted provider, you know. So
yeah, and I think there's a lot of pushback, definitely, with some being like, oh, I would only go see a doctor, or I would only go see.
I hear that too. I would never go to a nurse injector.
I would only go to a nurse. Like it's either like I'd either only go to a nurse or a doctor or physician, whatever. And they're like, why would you trust just like an SD or just anyone? I mean, I remember when I was looking at jobs like way back when, it was, and this was when I first moved to San Antonio. There was one, and it said we're hiring a receptionist, and in the description like, hey, hiring a receptionist at our med spa, but we will train you also to do Botox later. And I was like, what?
I feel like there's a component though with physicians, if they're not plastics oriented, they don't really have that creative eye. And I think that's the 50-50 or the 100-100 mix, however you want to say it, when it comes to aesthetic medicine. You need that the eye for design, for symmetry, for beauty.
Yeah.
And some people are very like, logistic, like they're super smart, but they can't tell me why you would do a little bit more on this side of the lip to, you know. So that's a blend, and I think that's where patients pick, you know.
But then like Botox and filler is different. So it's like, do you think those same principles when it comes to doing filler on someone's face if you're like not a nurse?
I would be scared.
Right? No,
it's kind of like weird. I'm like, okay, say I tell you like, hey, I want to lift the rhinoplasty, and I'm like, you know, where are the arteries that you're gonna definitely try to avoid? Where are they coming from, and what are you gonna do to try to avoid them? And they're just kind of like, no thanks, I don't want to be blind because you know, and filler is not worth blindness. So
right. And guys, I've been open before about our thoughts, at least on the last podcast about this. I mean, we haven't interviewed someone, you know, with this much experience and who's doing this every day, but like in SD school, yeah, we did anatomy, but we didn't like, you know, they're not like here's how you inject them, or here's like all the muscles of the face. Yeah. It was very
some
basic.
of us took cadaver courses, like real dead bodies, and do like injectable courses to really look at the face.
Oh, I would so prefer I would so prefer someone dead than living.
This is gonna hurt.
No, when I was doing tattooing for like a weekend, we literally did pig skin, and it was helpful because I was so afraid to mark somebody.
This is Jackie here. I could not edit this part out. We are taking a short commercial break. Bye-bye. And we're about to return in one hot second. Here we go.
I was like, no, my phone. So I told everyone I was filming today. Okay, but yeah, anyways, you know, I do think, I mean, I've said this before, I do think, you know, you should know a little bit more than just being an esthetician. I do think, like, at the bare minimum for me would be like an LPN
or an apprenticeship.
Is it called LPN or LPN?
Both. Yeah. Sure. Yeah.
Gotcha. I meant here. Sorry. I
feel like if they want to make an in between, like let's say an injectable tech, like because you know you have like med techs, ultrasound techs, right? You know, that are good at the technical portion. Great. But I feel like there needs to, just like the radiologist, he needs to be close by to kind of evaluate things.
Oh, so they would be like a medical director? too?
Yeah.
Radiologist? Is there a doctor?
Well, so I'm saying for like, you know, like when you have your ultrasound tech, they kind of know, when you know that they know what they're seeing, they've done it so much, they know the technical portion, but at the end of the day, do they know the treatment? Do they know everything beyond that? Maybe not so much, but they're very good at doing the job.
Right.
So I think if they made maybe a category like that, where like say like, hey, you have to pass this 6-week course and do this many hours and blah blah blah, and then to make an injectable tech, I think that would be a happy medium for states like that, honestly, because it just shows there's something that you're safeguarding. If there's nothing that you're safeguarding, it doesn't matter if I do a bad job or not. You know what I'm saying? So like when I'm trying to protect my license, not only am I trying to do a good job for the patient, I'm trying to do a good job so I can keep doing my job. If there's nothing for me to lose, then it's kind of like, oh well, I messed someone's face up and then I got fired and now it's enough. You know, so that's just kind of my thought on that. Maybe happy medium tech would be, I think, okay.
Right, because I feel like when you are like opening your own practices and you have a medical director that's, you know, hours away, it's like something bad does happen. Like, what are you gonna do?
Yeah, vascular occlusion happens. What are you doing? You know,
She's naming all these things. I'm just like, yeah. What if a vascular occlusion happens? Damn.
What are you gonna do, Jill?
Well, for me too. At least in Texas, you probably didn't hear about this, but there's a radio host in Dallas who she was getting a IV at a med spa, and she got up and she collapsed and died. Her medical director was not there. They like, for me, if something like that happens, do you know how to save someone's life too? Like, it's not just like what do you know how to do what you're doing. It's like, if something does happen, like what do you do afterward?
You don't, only if you get the good result. If you know what you're doing, only when you're getting a good result, then you know what you're doing.
Right. We didn't learn CPR and anesthetics, you know?
So yeah, they tightened the rules on the IV infusion clinics a lot, because all those, there was a few of them, I think there was 3 or 4 in a span of a couple months, and they were just not, I guess, compounding their products properly. But when you do, it is so much more expensive. So people try to become a compounding pharmacy within their med spa, and that's where it kind of goes left, because you're messing with things that are going into people's bodies. So.
And another thing, guys, is don't just be careful of the price you're seeing too. Like, when you see someone that's
good to be true.
lower priced, it is too good to be true most of the time. Like, providers like, you know, Lakeesha or other RN doctors charge what they do, because they do things properly in the right way. They're getting their supplies from
compliance.
America.
To be FDA approved. Yes.
Yeah, yes. FDA approved. I don't know why I said that. I was like, not from the black market.
I mean, it's very easy to obtain, and I think that's where people fall into the trap of like, well, it's so easy for me to get, then it shouldn't be too dangerous. And it's like, this is still medicine, guys. You're still injecting like a toxin into your face.
And it's hard, because I did get certain clients who said, oh, I just went to Mexico for Botox filler or whatever. And I was like,
and see, and my thing with that is like, they probably have the same types of products, and their standards are different, but their prices are so much cheaper that, you know, people going close by, that's probably a good lucrative deal for them.
Right. Like, for me, I haven't looked into it enough to really know. Like, okay, are their products, you know, safe? Are they Mexico approved? Like, so I don't even know the terms.
Right.
So it's hard, because, you know, I had clients that, you know, saw their dermatologist in Mexico. I just don't know what they're injecting, but I just,
and the laws, are different.
It's, America does things a little bit differently.
Very stringent. But then on the flip side of that is, you have to look at also, America spends so much on healthcare, and we have like one of the worst healthcare systems that there is in a developed country. Wow. So it's kind of like, I feel like it's a double-edged sword. So it's kind of like, you know, to stay in compliance, I have to follow American laws. Okay, got it. But at the same time, you'll see, like, you know, when you're on the internet, that is from different countries, different injectors, like, will come up on your feed, and they're doing things or using products that are a lot cheaper, that are still safe, that have been tested in their studies, but because America doesn't find value in big pharma or it's not going to profit off of it, they say, oh no, you know, that's not safe, we don't know. And so I think there's also a little bit of, uber patriotism when it comes to that, because kind of like America's standard is the best one. It's like, no, Korean skincare is, and they're doing things. They're doing things that they've been doing things for so long that America's still kind of like, we don't know if it's safe. And you're like, how do you see their skin? You know,
seriously though, like, Koreans, you know, they have just made these like
advances.
they've had these herbs and these rituals over like, you know, since like many dynasties ago. I don't know if that's the proper terms, but you know, like they know what they're doing, and you know, they say Korea is about 10 years like advanced, 10 years above America, and I do use Korean products in my practice. That's a whole other topic. That'd be a good episode, but anyways. But yeah, I mean, I guess we can't, you know, throw stones at other countries,
right?
Because so we really do not know, right?
Yeah. So I think it's double edged. So it's like I respect it, but at the same time, I see that it's not necessarily all because of safety reasons. There's a little bit of cash talk behind there.
Right, and it's hard to if you have someone who's being treated in another country and then they do come to see you, and then you're like, I don't know what they did to you. I don't know what they, you know. There's just so many. There become so many questions, and you're just not sure anymore.
Yeah, right. The standards vary so wildly.
But okay, coming back to America. Love that movie, but anyways.
Great movie, classic.
Anyways, what do you provide at your spa?
So I recently took off the basic facial off my menu. I just did not enjoy doing them, honestly. And I had to just be real with myself that I was like, you know, I get so much anxiety, and it was one of the least, you know, paying services that I offered. And I was like, you know what, I'm sorry. I'm gonna get rid of it. So now we do like microdermabrasion, with, you know, the diamond tip. We have hydrofacials, we do chemical peels, so I do glycolic, lactic, all that, but also I do my VI peels. You can see there. So I do Botox, fillers. Lips are like one of my biggest things that people come to me for. I recently got, I don't know how you pronounce it, Letbo. It's kind of a Botox competitor. It's one of the first FTA, like, Korean made. So I'm excited to trial that now to see, you know, how that's going to work compared to my regular Botox girlies, you know, what their thoughts are. I do hormone replacement therapy or just gynecological wellness in general, like PCOS, PMDD, all those kind of things. Holistic women's health. I do weight loss management with GLP-1s. I am going to start offering in the new year fertility treatment packages. So that would be, so teaching people how the basics of even going down tracking to doing Clomid or any kind of, you know, ovarian stimulating things. So I do the whole lab panel, track their cycles, track their hormones throughout that. A real big breakdown for the people who feel like they've just been constantly told, it's normal, it's normal. It's like, okay, why can't I get pregnant? Or why is my cycle always, you know? So I do a lot of that. The fertility will end up also having a PRP, I haven't decided yet, a PRP wash likely of the intrauterine wall. So right before it's your implantation date for doing IVF, or right before your ovulation, I will actually go in, you know, drop blood, spit it down, centrifuge, and then wash it inside your uterus with that nice rich plasma to kind of give it a nice stickiness and, help the baby.
I'm like, I didn't know this was a thing.
Yeah, so that's coming
up. A uterine wash.
Yeah.
We're going to part 2.
Yeah, so
like I could talk to you for hours about this stuff.
So you see why I dropped my basic facials, because it was kind of like I had, you know, things, other ideas. So I was like, you know, let the SDs have the facials. They're better at it than I am. They're, you know, that's their thing. I would rather prefer getting one from an esthetician than for me. So I'm like, yeah, let me just do the medical stuff a little bit more. Let me amp that part up. You know, from getting where I fit in, kind of. So that's kind of my niche. I know people are like, how do you do holistic and then also do filler? I'm like, because women are whole beings, you know. Sometimes we want to be Meg Thee Stallion, and sometimes we want to be, you know, Celine Dion and all like heavenly floating through a field.
I think it's diversity. I love what you just said, by the way. That's literally my same thoughts, because I do have people come to see me who are like, okay, are you holistic or are you medical? And it's like, why can't we be a little mix of both, right?
That's so my slogan is where science meets soul, because, you know.
Oh my god.
Yeah, that's my website.
That is amazing. That is amazing, truly, because I feel like everyone's like trying to put someone or providers in like one box. But like, why can't we check a couple boxes?
Yeah, let me help you.
Yeah, especially, you know, someone like you who you know, you do know the medical side. You do have all this experience, but now you are offering more, like holistic treatments for those who need it. Like I think there's a time and a place for medicine, and there's a time and a place for just, you know,
Being pretty.
being pretty. Yes, for just enhancing our looks. We shouldn't get so much hate as women. I mean, we go through so much with birth, postpartum, pregnancy, kids. Like we change and we want to feel good. So, like, what the hell? Like,
Yeah, and I'm so big on like women like coming together. So my hope is when I get a space that we'll be able to do some community events for women to kind of get together, kind of feel that community, whether it be like moms group or, you know, girls without kids group or whatever it be. If you want to do a community meditation or whatever.
You need like a girls' night out.
Yeah.
Yeah, mom's night out. Getting pretty and pampered.
Yeah. I love doing talks parties. They're my favorite because everybody gets, you know, their talks and then we all go to eat later.
Oh, I love that. I love that. Oh my gosh. Well, I think that's all I have for you today, but we'll have to bring her back to dive into some more topics around, you know,
Health,
yeah, health, beauty, and medicine. I think there's always like new topics coming up, and there's new trends and just like new science to be.
Especially in aesthetic medicine, it's always evolving and changing.
Yeah.
Like recently, the RF microneedling is like now the bad thing when it was like all the rage for a year and a half. You know what I'm saying?
The Morpheus
Yeah. So now, So you know, within 3 months it'll change.
Right. Well, you just can't go so damn deep in that freaking face, y'all. That's what you're doing.
Melting people's faces off. Yeah. Like Two-Face.
I'm nasty. She was like, I was asking her about her RF microneedling device. So I was like, okay, which one do you use? What do you do? She was like, okay, this is the one I use, but listen, you only go, I think she said like 1 millimeter. Don't go up to 3. Don't go, like, I said, okay. She's like, yeah, for the body, you can do deeper, like, you know, deeper is not always better, especially like on your face. Like, slow and steady. Slow and steady wins the race. Some people aren't even candidates, so you just, I don't know, if you're not a provider and you're just, I don't know, you just want to learn more about beauty, definitely go to someone who has lots of experience, lots of glowing reviews, and, you know, and it's hard to find a provider you trust, but, you know, go with your gut, go with your reviews, please.
Yes.
Experience. Yes. But to end, what would be your best advice for someone who wants to get into the field of, like just aesthetic medicine? Like, what if you were to do it all over and you wanted to be like in your position? Would you go the same route? Would you say, okay, I want to open, you know, my med spa? Like, what do I do?
So if that was my ultimate goal. What I would do is I would probably get my 2-year nursing degree, so your ADN license, and then try to get into a med spa. Get your foot into a med spa, get a derm office. That's your second best, or a plastic surgeon's office. So something to do with aesthetics as far as that. Get experience. You can get it's called CANS, I think Certified Aesthetics Nurse something. So basically that's kind of like your certificate. Like I'm certified in obstetric nursing. There's certification for nurses for that to say, hey, I have specialized in this. So that would be your next step. And then get as much experience as you can. And then honestly what I would do is I would become a family nurse practitioner. Because you can see men and women. I cannot see men, and that's the only drawback, which I'm fine with. So I'm totally fine with not seeing men. All the men who have approached me so far have been creeps and weirdos, and like, yeah, I have to like block them. So I'm totally fine with my patient population, but if you want to expand and be able to see more people, then definitely get your family nurse practitioner. You can see everybody.
Wow, I guys, I didn't think about that.
And so that would be a faster, probably direct route. You could probably knock that out in 5 to 6 years.
To go ADN and then NP. So you can go straight from ADN to NP.
There's some programs, I think they're dropping some of them, but honestly, you can do your bachelor's. Like I did it online while working. So I was able to work in, you know, my field while still getting my bachelor's. You know, it was a hybrid course. And so it's kind of like once you become the nurse, you're just stacking on as you're going and as you're getting that experience. And then by the time like 6 years hit and you have your family nurse practitioner, you still already have aesthetics background. So now it's kind of like, now I just have more authority.
That is, wow, that's amazing.
So there's your steps.
There's your steps. 2 years and get your foot in the door.
Yeah. Yes.
Oh my gosh. Well, thank you so much
Thank you for having me.
For coming on Local Beauty. And we're gonna do a part 2, guys. I already have like more questions, more stuff, but I don't want this to be 2 hours long. Well, thank you for joining us today, and I'll see you on the next one. Bye. Bye.